Darling, we need to talk about sneaky surgery and body dysmorphia. So as many of you will have heard, last month the press was awash with Zac Efron and his facial transformation of 2021. Now, Zac has denied any plastic surgery rumours, claiming the changes were in fact due to his recovery from a nasty facial injury on his chin. And whilst I'm not here today to confirm or deny any of these rumours, we have to discuss why so many have questioned his facial changes. I would suggest personally it's because of the rise of sneaky surgery. Surgery and aesthetic medicine have become more and more accessible, to the point that here in the UK they've almost become too easy to access, with many unregistered and unregulated professionals now offering cheaper and riskier aesthetic and injectable options. There's an increasingly open dialogue on social media about plastic surgery and aesthetics, with many now seeing it as a flex. But we also have to note the opposite, the rise of sneaky surgery. In my mind, sneaky surgery is obtaining very natural cosmetic work secretly, then denying any work has been done. Those of you who know me know that I am myself a very private person, and in a world of social media which pushes you to share your whole life for affirmation, I do think that it's okay to keep parts of your life private and set healthy boundaries. However, I think transparency around cosmetic surgery is essential, because without it, we start to see a world of often unattainable perfection and beauty. When we look at a sea of faces and bodies without flaws, we will begin to judge our own much more harshly. Particularly when the owners of these faces and bodies deny having any work done. Whilst aesthetic medicine is becoming more accessible, it is still very expensive, and in the recession we are plummeting into, for many of us this will mean not having the funds to keep up with this level of perfection, or opting for cheaper, more dangerous aesthetic options. So we can't talk about the illusion of perfection without discussing body dysmorphic disorder, also known as BDD. The clinical chat behind BDD is that it's a condition which involves spending a lot of time worrying about your appearance. Now, this can range from low-level consistent anxiety about a part or parts of your appearance, to comparing yourself to others, intrusive thoughts about your appearance, spending significant time, energy and money on altering your appearance, right through to developing obsessive-compulsive tendencies, self-harming, skin-picking, and even refusing to look in mirrors. The reality is, we simply do not know enough about how BDD develops, but we do know a significant factor can be unprocessed trauma. In my own practice, I see unprocessed emotional abuse from parents or caregivers, bullying, and abusive romantic relationships to be significant contributors to the development of BDD. But I also see a significant rise in young people consistently exposed to sneaky surgery and realistic filters, finding it difficult to build confidence about their own natural appearance and building on the traumas that they're experiencing. It might sound extreme to some, but I do think that excessive exposure to synthetic perfection online is actually a trauma within itself. Now, here's where I put my hand up happily and say, yes, I have actually had work done myself. More importantly, if anyone asks me, I'm honest about it, and in certain situations when appropriate, I'll even offer the information. Just this year, I started to have Botox Light, or baby Botox, as it's known, to correct a slightly asymmetrical eyebrow due to an injury when I was a child. Similarly, I had Invisalign without the optional teeth whitening in 2020 to correct a tooth impacted by a separate childhood injury. And yes, I was fairly accident prone. By being honest about the aesthetic work I have had done, I'm helping break the illusion that any one of us is perfect, and that yes, it is okay to go under the knife or needle if you feel like it contributes to your health and well-being. Though, if you're already having work done or simply thinking about it, I would ask you, are you doing this for yourself, someone else, or even just to keep up with a trend? Molly May very honestly and openly documented her move away from lip filler, having it dissolved, after her sister helped her recognise she'd gone too far, that she was no longer doing it for herself. Whereas stars like Dove Cameron and Blake Lively have been silent on surgery rumours, neither confirming nor denying they've had any cosmetic work done. This, of course, creates a storm of speculation, insecurity, and what feels like a vision of unattainable beauty. And darling, just in case you haven't been told this week, you're absolutely beautiful. But if you're thinking about having any cosmetic procedures done, please work with a registered medical professional and make sure you're doing it for yourself rather than to fit into a trend or to adhere to someone else's standards of beauty. And of course, if you enjoyed these millennial musings from this trauma and eating disorder specialist, hit the like and subscribe button and the bell to be notified of any new videos. I'll see you next week, darling.